St. John's Wort, a popular supplement in your local grocery store for $10 to $20. It is held as a over-the-counter cheap alternative to antidepressants. It has touted for all these so-called health benefits, and some of this information is being put out there by practitioners, by nurses, by your chiropractor, by your naturalist, by your herbalist, by your healthcare store, by the internet researcher. But it's got a lot of pitfalls, it's got a lot of dangers. It's time we seriously have a talk, especially if you got bipolar disorder.
Welcome to Truth Custom Made. Come in and have some lemonade. Reality will readjust while we evade the issues that are pressing us and getting so depressing. But undressing and unstressing makes them go away. We're tired of solid ground.
If you work in a healthcare field or allied healthcare field or alternative medicine field, please do not recommend St. John's Wort to anybody. You need to have an idea how this medication, how the supplement is going to affect other medications that person may be on. You're going to need to have good assessment skills. You're going to have to know which medications that they take before you even recommend anything like St. John's Wort. The problems that you get with the depression is that a small number of people that were unipolar depressed may have already been misdiagnosed to begin with. They may actually have more like a bipolar 2 disorder, and that mania has not shown up yet, so you have to be carefully monitored for symptoms of mania or hypomania. When you tend to lose that inhibition and you're more impulsive and you either get depressed or you start using the other medications on the side, this is a situation where you're going to get the majority of your suicides. Don't create a situation that may or may not be there yet. If that person has what is known as straight depression, and you need to assess whether or not there is manic depression or bipolar in the family. And I say manic depression or bipolar because it is the same thing. But some people only think of manic depression. They don't consider it bipolar, when really bipolar and manic depression are the same thing. But because of that depression word being in there, people are going to think, oh, I'm depressed, I need an antidepressant. Or I'm depressed, I need some St. John's Wort. And the answer is no, because you're not going to treat manic depression with the antidepressant. You're going to tend to either use lithium or an anti-seizure med. This is the preferred way of treating it. Very rarely are you going to add an antidepressant, and you only add that antidepressant once you have a lithium or the anticonvulsant as your stabilizer, your mood stabilizer. That is your primary treatment, is to have that mood stabilizer. Then a psychiatrist can tinker around with adding a tiny level of an antidepressant if it's needed. So please do not recommend St. John's Wort to anybody. If you need to add anything to go with the antidepressant, you're really going to need to do it either through diet or through exercise in order to get natural boost of those serotonin levels. So please, whatever you do, please Stop recommending St. John's wort to anybody. If they're already on St. John's wort, they need to get off of it. They need to, if they're on prescribed medications like Coumadin and digoxin or Depakote or lithium, they need to get in touch with their physician. They need to work with it as far as coming off the St. John's wort, checking those blood levels, because they need to find out what the levels are going to be off the St. John's wort so they can make adjustments back down. So please, whatever you do, do not recommend St. John's wort. And let's talk about how depression works. Imagine a 3-story building with a basement, and your main ground floor is where most people normally reside. You're not depressed, you're not elevated. You're just there in your natural state. The basement is your depressed phase, and for depression you need to be in it for about a week or 4 days. If you're on the second floor, that is your hypomanic floor, and your more manic floor is on the third floor. And in mania or hypomania, you tend to lose inhibition. You tend to become more impulsive. Your mind tends to race more, and you may not pick up on that. You tend to sleep less. And you need to always feed those dopamine receptors. So you tend to start getting extreme spending sprees to try to satisfy that brain. Alcohol more often to satisfy that brain. Maybe some drugs in order to satisfy that brain. Maybe more sex to satisfy that brain. All the feel-good things are produced by higher amounts of dopamine as our neurotransmitter. And it affects different parts of the brain. So some parts of the brain affect your sleep, some parts, like in the front, do your inhibition. And so you tend to lose that. And that can be extremely dangerous. In a mania state, things get extreme. This tends to cause issues, people doing far more stunts than that's safe. And they also tend to wind up getting some legal trouble. They're not able to sleep. They're not able to produce at a level on their jobs that it can affect their job performance. You can find yourself in severe amounts of debt from the overspending, and because you're more impulsive as a spender, and you tend to need to get more lavish as a spender. The hypomania is a more milder form of that. But how it relates to the building is you're in the depression phase, and you just want to come out of the basement back to the ground floor. So if you got straight depression, you either take the St. John's wort or you take the antidepressant, and you basically go from the basement to the ground floor, which is where you want to be at. If you are bipolar, whether it's a type 2 or a type 1, you're not going to the ground floor. You are going straight. A bipolar 2 will go from the basement to the second floor. Type 1 bipolar is normally not in a depressive phase. They will go from the ground floor to the third floor, and beyond. So that's not where you want to be. In fact, with bipolar, which is known as manic depression, you should not be using an antidepressant in the first place. That is not the top line way of treating bipolar disorder. It's either lithium or anticonvulsants. Okay, so it's either lithium or anticonvulsants. And the anticonvulsants are the majority of how bipolar is being treated now. And only as a last resort or as an adjunct therapy will they order a small dose, a tiny small dose of an antidepressant. But it is preferred that you not be on any antidepressants at all, because you will go straight to the second, straight to the third floor, and you only need that one swing. That one swing Once you've gone from either depression phase or a normal into a manic phase, your life has now changed. There is no more straight depression. You are bipolar. Welcome to the club. Okay? You're bipolar. It's not going away.